If you're a mouth breather or have constant nasal obstruction, you may be a candidate for a nasal procedure called a septoplasty and turbinate reduction. Before introducing these techniques, we will first describe briefly the anatomy of the nasal cavity. The wall that divides the left and right side of the nose is called the nasal septum. This wall is made up of both bone and cartilage. For some, the septum may be crooked or deviated. This may have occurred from trauma, perhaps as a child, or you may have been born with a deviated septum. Correcting the septum is called a septoplasty. The turbinates are fleshy shelves on the side of the nasal cavity that congest and decongest, but for some may cause continual blockage of the nose and sinuses. The turbinates are what enlarge when one becomes congested, oftentimes from allergies or a cold. If the turbinates are inflamed for prolonged periods, they may become persistently enlarged. Turbinate reduction is the technique often performed with a septoplasty to reduce the size of the turbinates. Both techniques begin after you are given a general anesthesia. Once you're asleep, a single incision is made inside the nose to access the cartilage of the septum. This incision is not visible. The septum is then straightened by reshaping the cartilage. The turbinates are reduced by removing a small bone from the inside of the turbinate. This allows the turbinate to collapse without destroying the outer mucosal layer of the turbinate, which participates in keeping the nose moist and directing airflow. Once this is complete, a plastic splint is placed to prevent the septum from moving, as well as reducing the risk of scar formation. The total time for this nasal procedure typically takes 20 to 45 minutes depending on the complexity. Afterward, there are 3 common complaints. The first is that you will not be able to breathe well through your nose. Although the plastic splints have a channel that allows you to breathe, this channel is often clogged. Dr. Pasha rarely uses packing or cotton in the nose. If you speak to other patients who have had a nasal operation by another surgeon, they may say the worst part of the procedure is when they remove the packing. You will not have this experience unless you bleed. Dr. Pasha uses dissolvable packing. Nonetheless, you will have post-operative drainage for 2 to 4 days. Finally, you will be congested until the splints are removed 1 week later. After that 1 week, you should find a dramatic difference in your nasal breathing once the splints are removed. Significant pain and discomfort is uncommon after the first 1 to 2 days. This is not a cosmetic procedure and the nasal bones are not touched. Only the inside of your nose is changed. No one should be able to recognize that you had a nasal operation except for the fact that you breathe better. Septoplasties and turbinate reductions are routine cases with rare complications. The most common risk of the procedure is bleeding. If this occurs, you may require nasal packing, which is often removed in the operating room to avoid further discomfort. Other rare risks include recurrence, especially if you do not take care of your nose afterward, with nasal sprays and allergy management. The risk of general anesthesia, as well as other rare complications, will be discussed with you in the office. Patients find that nasal surgery provides a dramatic difference in the way they breathe. Many patients who are lifetime mouth breathers are shocked by the benefits of breathing properly through the nose. We hope that you have a better understanding of nasal surgery, and we look forward to helping you breathe freely, both day and night.